Welcome to Requiro. Today we are going to be talking about invisible disabilities and basically how normal everyday people that don't have anything wrong with them do not take people seriously when they have a invisible disability, and even how much they love to preach they say they do, they bluntly don't because they can't see it with their own eyes, or it's not like it is on in the movies or television shows. Even if you can't see someone's disability, it doesn't mean it doesn't exist, and people need to show more empathy and understanding towards people that have invisible disabilities. So basically that's what I'm trying to make this video is. It's not really a video about me explaining what invisible disabilities are. I'm pretty sure everyone knows what it is, but I just kind of want to get across of how much people that have invisible disabilities that are struggling because of the stigma against having invisible disabilities. And basically I want to make this video because I just want to talk about it, where basically society does not care whatsoever about people that have invisible disabilities. I do have one myself, but that's more of a learning disability. I've mentioned it a couple of times in the past when I messed something up. That is a invisible disability, but we will talk about that when we get to that later on the video, and the stigma against it. So basically I just want more people to show more sympathy and understanding towards people who have invisible disabilities, because society does not care, and how much they love to preach to say they do and they've changed, they don't. They just don't. And also I do want to handle this with respect and understanding, so if there's anything, I mean anything I got wrong, please let me know in the comments down below, and I'll bring it up in my next video, or I'll pin it down below. And if you guys have your own personal stories about dealing with a invisible disability, and if you feel comfortable and you want to share your own personal experience about having a invisible disability and basically dealing with doctors, people, friends, family, etc., not understanding or getting the situation whatsoever, please put it in the comments down below. Or if you don't want to do that and you just want to send me an email, and I'll happily read it. My email's on the website, so go check that out and I'll happily read it. If you feel comfortable, please don't feel pressured whatsoever if you don't want to. Again, this video is just meant to be spreading more awareness. I'm going to be talking about physical invisible disabilities like chronic pain and chronic illness, and I also know underneath the same umbrella is also depression and learning disabilities and all that. That's also underneath the same umbrella as invisible disabilities, but I am going to break this video up into 2 parts. So this will be a first part. It would basically just be me talking about invisible disabilities, but more physically, like chronic pain and chronic illness. And then in the next couple of videos I'll make a video talking about mental invisible disabilities like learning disabilities, mental health. But I also feel like mental health is its own separate category, even if all those conditions are in the same type of boat. That makes sense? So those will be future videos. This will just be about physical invisible disability. Again, I am one person on this channel, so I will get things wrong, I will make mistakes, and some things I just will bluntly won't get right, even if how hard I try looking into something. So please let me know. If I get anything wrong. I'll pin it in the comments down below, or I will bring it up in my next video. Blah blah blah. Another thing I would like to mention is always please do your own research on basically anything I talk about basically on this channel, because I am only one source delivering some information on things, and you can always find your own research in your own time and all that, and you can get a better awareness about the situation. So again, please always do your research. I'm always going to recommend that. I'm just another source. So yeah, Anyway, let's get into the video. So this is basically the definition of what a hidden disability is. I'll put it up on screen for you guys.
These are often referred to as hidden or non-visible disabilities. A non-visible disability is described as a physical, mental or neurological condition that is not visible from the outside, yet can limit or challenge a person's movements, senses, or activities. Point 2. Non-visible disabilities can include traumatic brain injury, dementia, learning difficulties such as dyslexia, chronic health conditions such as diabetes and Crohn's disease, and mental health disorders. 3. In 2020, 14 million people, 21%, in the UK reported having a disability. Of this number, it was estimated that 70% of the disabilities were non-visible. For having a disability or a chronic health condition can be a life-changing event in one's life. Going through this process can be made even more difficult by having to deal with a significant amount of stigma associated with disability. I have seen this firsthand with my mother, who is a wheelchair user.
That is the definition of what invisible disabilities mean in the best way possible. Again, I always try to find the best way to explain what something is in these videos, not the just basic Google result. These are some umbrella terms of what some hidden disabilities are. Again, this is for like all of them, not just for like chronic pain and chronic illness. Chronic illness, visual and audio impairments, chronic pain, chronic fatigue, mental illness, and chronic dizziness, and learning disabilities. Again, these are all just umbrella terms for what a hidden disability is. And just because this is a really big topic and there's so many different out there and so many different names of so many hidden disabilities, like I said earlier in the video, I'm basically just going to be focusing on physical hidden disabilities, and I am going to be talking about mental hidden disabilities in a future video. Here are some examples of some conditions people have if they have chronic pain, and basically the little blurb of like what basically having that condition means and what the person goes through. So I'll put it up on screen for you guys.
Fibromyalgia is a condition that causes pain all over the body, widespread musculoskeletal pain. It may be accompanied by fatigue, sleep problems, and emotional or mental distress. Patients with the condition may be more sensitive to pain than others. Studies have linked fibromyalgia to how the body amplifies painful sensations due to the brain's ability to process pain signals. Usually, fibromyalgia occurs after physical trauma, infection, psychological stress or surgery. Sciatica refers to the pain that radiates along the path of the sciatic nerve. The sciatic nerve is the longest nerve in the body, running from the hips to the feet. When the nerve is pressed or irritated, it can lead to pain. The pain radiates from the lower lumbar spine to the buttock and down the back of the leg. The pain can be moderate to severe, accompanied by tingling, weakness, and numbness on the affected leg. Severe sciatica can be debilitating, preventing movement. Complex regional pain syndrome, CRPS, is a chronic pain condition that affects one limb, foot, hand, leg or arm, after an injury. It usually stems from damage or malfunction of the peripheral and central nervous system. The pain is described as burning, pins and needles or squeezing sensation. Aside from the severe pain, other symptoms include changes in skin color, temperature, or swelling of the affected limb. Arthritis is a condition characterized by inflammation of one or more of the joints in the body. The main symptoms include pain and stiffness, which affect mobility and worsen with age. The most common types of arthritis include osteoarthritis, rheumatoid arthritis, and gouty arthritis. Arthritis pain, called arthralgia, can feel like a dull ache or a burning sensation. Gout is a form of arthritis that develops in some people with high levels of uric acid in the blood. It causes intense pain, stiffness, and swelling in a joint, usually the joint in the big toe. The pain is described as if the foot is on fire. Slip disc pelvic intervertebral disc prolapse or slip disc is a condition in which the soft cushion of tissue present between adjacent spinal bones pushes out. A slip disc can irritate nearby nerves, resulting in pain and numbness or weakness in an arm or leg. The pain worsens after sitting or standing, walking short distances, and with certain movements. The pain is more severe at night, and is accompanied by burning, tingling, and aching sensations on the affected area. Trigeminal neuralgia. Trigeminal neuralgia or tic douloureux is a chronic pain condition that affects the trigeminal or fifth cranial nerve. It is one of the most painful conditions known. It causes extreme, sporadic and sudden burning pain or electric shock sensation in the face, including the eyes, lips, scalp, nose, upper jaw, forehead, and lower jaw. Sickle cell disease is a group of blood disorders that affects the structure of hemoglobin, the oxygen-carrying component of the blood. People with this disease have an abnormal form of hemoglobin called hemoglobin S, which alters the shape of red blood cells into a sickle or crescent. A major symptom of sickle cell disease is periodic episodes of pain, called crises. The pain ensues when the sickle-shaped RBCs gather together inside the small blood vessels in the abdomen, joints, and chest, and block the blood flow. In some cases, bone pain can also occur. Migraine headache. Migraine is a recurring type of headache that causes moderate to severe pain of a pulsing or throbbing character. Typically the pain occurs on one side of the head and is accompanied by nausea, vomiting, and extreme sensitivity to sound and light. The pain can last for hours or even days, with pain described as so severe it can be debilitating.
Those are a couple examples of some conditions that can give you chronic pain, and I know there's so many more out there that I bluntly just could not find whatsoever, just because it's in a different category or it's very broad or very niche. I'm doing the best I can, so if you guys have some chronic pain that I did not mention in this video and you want people to know more about it, please put it in the comments down below, or again send me an email. I'd love to learn about it more, broadening more of my own horizons about people with these conditions. Here is a couple of examples of what chronic illness is.
Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes, and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. Chronic kidney disease, CKD, refers to all conditions of the kidney affecting the filtration and removal of waste from the blood for 3 months or more. It is identified by reduced filtration by the kidney and/or by the leakage of protein or albumin from the blood into the urine. Asthma is a common chronic condition that affects the airways, the breathing passage that carries air into our lungs. People with asthma experience episodes of wheezing, shortness of breath, coughing, chest tightness and fatigue due to widespread narrowing of the airways. Cardiovascular diseases, CVDs, are a group of disorders that affect the heart and blood vessels. The primary cause of most CVDs is atherosclerosis, a buildup of fatty plaques in the arteries, which can lead to reduced blood flow and potentially life-threatening events like heart attacks or strokes. Chronic obstructive pulmonary disease, COPD, is an ongoing lung condition caused by damage to the lungs. The damage results in swelling and irritation, also called inflammation, inside the airways that limit airflow into and out of the lungs. This limited airflow is known as obstruction. Symptoms include trouble breathing, a daily cough that brings up mucus and a tight, whistling sound in the lungs called wheezing. Osteoporosis silently weakens your bones, which can make you more likely to experience a bone fracture, broken bone. Autoimmune disease is an autoimmune disorder occurs when a person's immune system mistakenly attacks their own body. Chronic obstructive pulmonary disease, COPD, is a common lung disease causing restricted airflow and breathing problems. It is sometimes called emphysema or chronic bronchitis. Multiple sclerosis (MS) is a condition that happens when the immune system attacks the brain and spinal cord.
I felt like I needed to include them, and I know there is many of chronic illness and also chronic pain conditions. Again, these are just the ones I could find. Like I mentioned before, if you have a chronic illness and you did not see it in my list, please let me know in the comments down below. I would love to learn more about it. Again, there are so many out there that I probably could not find whatsoever because of like how broad or how small it is. Again, please let me know. I would love to learn more about it. And here are some examples of some other hidden disabilities that are physical, like visually impaired or hearing loss.
Visual snow syndrome, age-related macular degeneration, AMD, amblyopia, lazy eye, anophthalmia and microphthalmia, astigmatism, Behçet's disease, Beatty's crystalline dystrophy, blepharitis, blepharospasm, cataracts, central retinal vein occlusion, CRVO, cerebral visual impairment, CVI, coloboma, color blindness, convergence insufficiency, corneal conditions, diabetic retinopathy, dry eye, farsightedness, hyperopia, floaters, glaucoma, Graves' eye disease, idiopathic intracranial hypertension, low vision, macular edema, macular hole, macular pucker, nearsightedness, myopia, ocular hysterplasmosis syndrome, OHS, pink eye, presbyopia, rare diseases, refractive errors, retinal detachment, retinitis pigmentosa, retinoblastoma, retinopathy of prematurity, Stargardt disease, Usher syndrome, uveitis, vitreous detachment, acoustic neuromoconductive hearing loss, sensory neural hearing loss, mixed hearing loss, and auditory neuropathy spectrum disorder.
There is a lot. So those are some examples of what some people deal with, like chronic pain or chronic illness, or even like physically dealing with some hidden disabilities that no one cares or understands about. And I know there are so many different hidden disabilities out there that I did not cover or I did not list in this part of the video. Again, I just could not find them. I think it's just because of how small or niche they are, and it just did not show up in my Google feed. Sorry about that, guys. Again, there are so many more out there, so if you have one and if you feel comfortable sharing, again, stigma, about society putting on people with hidden disabilities. So if you don't feel comfortable mentioning it in the comments down below, I'm totally fine with that. I understand. So now I kind of want to move on and talk about more of the stigma against having a invisible disability from like doctors, normal everyday people that have literally nothing wrong with them. And I want to talk about that because I think that's something that no one really talks about, but people that have a hidden disability, they deal with it on a constant basis, and people that are fine and have nothing wrong with them don't take it seriously or understand because, you know, they're not dealing with it themselves. And the shit thing about having gone through shit is people don't understand or truly get it unless they've gone through something themselves. And I think that's honestly a shit thing, honestly. I've noticed that in my own personal life, and yeah, that's kind of shit. Like, people need to show more understanding and empathy towards people, even if they haven't been through it themselves. And I found it very interesting when I was looking up research and different articles about trying to learn more about hidden disabilities and the stigma against it, is the people that are writing these articles, I felt like they've had, some of them mentioned they had family members or friends who've had a hidden disability, and they've seen and watched the struggles of those people that have a hidden disability and the fucking blunt stigma against it. And I'll put up on screen of one of the things I saw that I found very interesting when I was looking at these articles. I really want to show you guys.
I have witnessed people assume she is unemployed only to see the surprise on their faces when they find out that she works full-time as a specialty doctor in forensic psychiatry, and she drives her own adapted car. Navigating the stigma associated with disability can be even more difficult when you have a non-visible disability. The fear of being discredited or stigmatized can lead a person with a non-visible disability to conceal their disability. However, this could lead to the dilemma of them not receiving the support they need if they chose not to disclose their disability. 5. Even when they do disclose, they can face the additional challenge of not being believed or a lack of support and understanding, as their disability is not outwardly observable. I recently met a co-worker with a non-visible disability who told me that she often has to show people her blue badge to prove that she can park in a disabled parking bay. The first step to addressing an issue is to raise awareness that the issue exists. Initiatives such as the Hidden Disabilities Sunflower, which allows someone with a non-visible disability to discreetly signal that they may need additional help or support, have helped to increase awareness. 6. In Scotland, a young lady called Grace Warnock, who has a non-visible disability, Crohn's disease, was awarded the Points of Light Charity Award for her work on awareness of non-visible disabilities. She created a sign for disabled toilets that includes representation of non-visible disabilities after she personally was criticized for not appearing disabled. 7. The more work that is done to increase awareness of both visible and non-visible disabilities.
Again, who it is basically not just me who thinks this way. People need to stop putting the stigma against people that have hidden disabilities. Like, it's not their fault. They were born this way. They can't control having this hidden disability. It was just how they were born. And also in the same article, they talk about people that have hidden disabilities. Because of the stigma behind it, they want to hide it, and hiding their hidden disability because the stigma against it makes it harder for them to get actual help they need to basically function in society. And I've dealt with this myself as well with my own hidden disability, because going through high school, dealing with family members where I very much still do it. Like, I don't tell a lot of my friends about it. I've dealt with people in the past. Once I've told them I have that hidden disability, something like changes. in their mind, and basically the stigma they have against that hidden disability is already put on you, even if it's bluntly not true. And I don't tell my friends about it unless it's absolutely necessary, or if I have to tell people about it. My own little experience of I understand for people that having hidden disabilities and they want to hide it because of the stigma against it, especially just because of the stigma behind it, and it doesn't matter how hard you try, the stigma will never go away. And it's absolutely heartbreaking, like your hidden disability you have, they basically have a stigma about it and they plant that on you, and even how hard you try or do anything, they will always think that way, and it's bluntly not true. And I've dealt with that with my entire life, and I very much still hide my own hidden disability. Absolutely frustrating and so sad. And even when people do mention they have a hidden disability to get the help they need, the stigma is still very much there, or people like that are helping them, like doctors, caregivers, nurses, etc., because the stigma is still very much alive. And the shitty thing about it is, so many people preach and say, we care about so many people. No, I don't do that, when it's bluntly not true. Oh my god. And I kind of hate that about society, where so many people preach and say online, in person, how much they say, oh, we don't judge, we care about people, and then once it's actually brought up, they turn their backs and plant the stigma or mean things they thought about those people onto them. And it's absolutely disgusting and tragic, especially just hiding underneath the blanket of, oh yeah, we care about people. In reality, they don't. People like to say society has changed. It has in some places, it definitely has, but in other places, it has not, and they like saying they have, if that makes sense. I'm going on a little bit of a tangent, but whatever, this is my podcast. The shitty thing is, even doctors and nurses, the people that are meant to understand and get it because they went to school for 6 or 5 years to learn about this kind of stuff, even they push you aside and don't get it or understand, because and the symptoms you are explaining or telling that are not in the textbook format that they learned in school, or basically they can't see it with their own eyes, and that is so shitty. And it especially happens to people that are younger, that are like in their early 20s, that are in their teens, that are children, where they have chronic pain or they have a chronic illness. And that's even worse, because it's like, when you say you get older and you go fix the problem, and then doctors and nurses, they kind of go, oh, why didn't you tackle this problem sooner? And it's like, you guys disregarded me when you did mention it when you were a lot younger, and then they blame you for the problem when they are the ones that are failing people that have hidden disabilities. And what in hell is this world getting into, where we are just disregarding young people or even people that have disabilities because they can't fucking see it with their own goddamn eyes? It's fucking bullshit. I am sad and angry. And also the worst thing about it is, the doctors that should understand these problems you are going through, that are not visible through the naked eye, because you are a woman and you're young, they will 100% disregard you and just say, oh, it is just woman problems, like when literally women go through the exact same chronic pain, illness, all that jazz, same thing as men. even if there's been more tests done on men with those kind of symptoms, women still go through the same type of stuff as well, and it does not help whatsoever if you just paint those problems women go through because they're a woman. So much pain and suffering as well with this kind of stuff as well as men. It's 2025. We need to move past from shit from the 1800s, and it's absolutely tragic. Women basically get discarded more than over men with dealing with this kind of crap, especially if they're young. And I'm not just saying like women only deal with that if they're young and going through chronic pain. Men do go through it as well if they're dealing with like chronic illness or chronic pain and they're young. They still will deal with the same stigma and disregardness, but women just deal with it a lot more. So I do want to put that here. I realize some things I talk about, I get very passionate and then I kind of get very mad or I get very tearful. Maybe I shouldn't be a podcaster. Honestly, if you guys have a friend or family member that has a chronic illness or a hidden disability or dealing with chronic pain, and even if they are in their 20s or their teens or they are children, please try to bother to understand and get what they're going through, even if you've never been through it yourself. Please try to understand or sympathize with them, and feel free to ask questions if you don't truly understand certain bits, and then go look it up by yourself in your own time to learn more about the condition those people are going through and try to understand what the hell they're going through. And I think that can be used for like any other situation other than having a hidden disability, I think, as well, because those people have dealt with enough shit by basically society telling them they're lazy, they don't do anything, they're stupid, literally from something they can't control and something they were born with, or something happened to them, or anything like that that made them have this problem. Now, that's all I want to say here, is just please try to be understanding and respectful of people that have hidden disabilities. Now, I'm going to move on and bring up there's so much noise outside. I feel like every time I want to talk about something, every machinery person out there goes, you know, Meg's making a video. We should definitely make as much noise as possible and, you know, not let her film our videos when it's quiet. So now I am going to move on to basically show you guys some people's personal stories about, and basically society not caring about them, not respecting them, and not basically giving a shit about them or taking them seriously. Now, these are from like 2 different subreddits. Some of these stories are from the chronic illness subreddit, and then the other one is from the chronic pain subreddit. And please take it with a little bit of skepticism, because again, these are stories on the internet, but I feel like these are the most accurate places I can like find these type of stories. I do recommend to go on those 2 subreddits. There's so many stories on there of people dealing with having chronic pain or dealing with a chronic illness, and this is just a couple I found. Again, there's so many more on there that I didn't get around to finding and putting up in here, but I do recommend to go on there and check out all the other stories and be supportive, be nice to those people. So these are just a couple, and yeah, basically just to get the point across, to basically show you guys what these people are going through on a daily basis. And also in this part of the video, I'm also going to put some people's responses that I thought that were really interesting that I kind of also wanted to bring up as well. So I'll put these stories up on screen for you guys.
Why do people not take my pain seriously? 18F. Is it because I'm young, a woman? Why I'm in pain all the time? People either ignore it or just straight up tell me I'm fine and just being dramatic. I've learned to just pretend that I'm not hurting, cause if I look like I'm in pain all the time, people think I'm looking for attention. I'm not looking for attention, I'm looking for help. Every doctor I've gone to have said I'm fine. The only tests I've gotten done is blood test. That doesn't mean shit when my bones and muscles ache. Is it because you're a woman and young? Yes. Both these groups have a harder time getting their pain taken seriously, but it also happens in general when there is no obvious sign, like a broken limb or a cane. Still, please be persistent. There is no reason for you to be in constant pain. People on this sub have complained of doctors telling them they are too young to be in pain. That's a really stupid statement. Pain is just as bad at 20 than 80. I hate when a doctor tells me I'm too young to be feeling the way I do. Isn't it good to catch health issues early? Being young means you can never have serious, debilitating, excruciating pain. Also, yes, being a woman or a POC can really affect how doctors perceive your problems. My grandmother-in-law has chronic pain and she says that now she's older, doctors just say it's nothing serious, it's just because you're old, despite the fact she's had it her whole life. I think women just can't be taken seriously by doctors, it seems. How do you come to terms with the fact that a lot of people don't take chronic pain seriously? I have IC and it is bladder disease that causes me intense pain. Since it's not a visible condition, people never really believe me or understand how much pain I feel daily. I constantly have to bear through the pain when all I want to do is lay down in bed and cry. People always forget that this is chronic, that it never goes away. I can't make people feel empathy. But how do you mentally get past this? I feel like I'm going crazy and it's exhausted trying to justify myself and try to make people believe me. Oh sweetheart, everyone with so-called invisible disabilities like you have, like chronic pain, goes through this. I have a neurodegenerative disease, but you cannot tell from looking at me right now. I live in severe chronic pain. Many of us in the disability community have invisible disabilities, but we are just as valid as visibly disabled folks. Your pain is valid. Your disability is valid. Lot of people in this sub and other disability subs talk about how common it is for people to not take you seriously or not recognize you as disabled at all when you have invisible disabilities. I'm sure you get tons of all the cliches that people say: you're too young to live in chronic pain, nothing looks wrong with you, you look too good to be in chronic pain, etc., etc. Just forget all of those gaslighters if that's happening to you. This is a great community, and you are valid, and we are here for you, light blue heart. Yes, so many of us share your frustration and pain. It took me about a decade before doctors listened to me because externally, I look young and healthy. Most of my blood tests are within normal range, which is absolutely infuriating to hear many times over. But the MRI doesn't lie, and they can't argue about my obvious facet arthritis in my spine. You need to be stubborn as a mule to get proper treatment for an invisible illness. But we are here for you, because we all know what it's like. I often wish I could psychically beam my emotions and physical pain right into the doctor's brain. I bet they'd get on it pronto if I could do that. I'd love to see their faces go pale and wipe the patronizing look off their faces. Maybe someday we'll have the technology for that. I have IC, stage IV. A Harvard paper published in 2017 states in their research shows severe IC patients have roughly a quality of life as that of palliative cancer patients and people in end-stage dialysis. You are very real, valid and seen. I am so sorry. As far as coming to terms with this and the way you are not taken seriously, even after about 20 years of experience, it's a daily struggle. I have my tools and I have my issues with mistakes I still make. I'm here if you any questions. Some people can only relate to what they themselves experience. I'm always blown away by those who argue that my genetically verified, textbook presentation of a disorder cannot be real. I look too healthy, I cannot be having a migraine, I must be limping on purpose, have a psych issue, blah blah blah. I sincerely broke down crying to my DR a few weeks ago after he dismissed me as fat and depressed. Told him I literally cannot hold my head up longer than a couple hours. The only way it feels okay is to rest my chin on my chest. He suddenly started talking about more tests and steroid trials. Some people are just assholes. Some people are jaded or have seen liars. If they know you and can say that crap, then just dismiss them from your mind. Remember the Bene Gesserit pain box from Dune? I think we need one of those to convince people. I'm talking electrodes here. Being young and in pain is such a struggle to being taken seriously. Nobody believes you're in a lot of pain. Right now I can't work, function, so they think I'm lazy. My friends are disappointed because it's so hard for me to see them. I'm 29, but I know there are people even younger in so much pain. Just wish I could say to you all that I believe you and hope things get at least a little better. I do hope things get better for you real soon too. I swear if I hear, you can walk, you can talk, you're fine, one more again Elma start breaking shit. On purpose this time. Don't forget, but you look so good, surely it's not that bad. You must be exaggerating. No matter the age, pain sucks. It sucks even more when the people you interact with have real nice lives with barely any struggles, physical or otherwise. Yep, I'm 62 now and have suffered and struggled since early 30s. I can't get anything I want, but I am getting medication finally, regularly. I finally was taken seriously at 55, when I demanded MRIs, and they pretty much said whoops. Then I had a knee surgery and a discectomy. Now have a 3-level ACDF and a lumbar laminectomy in the works. When I was younger, I held the doctor in high regard, and just did what they said without question even when they did nothing. I thought they were all so smart and so knowledgeable and were experts when they really weren't, especially my PCPs. PCPs have ended up being the biggest hindrance to my health in every way, with their arrogance and ability to easily blow off anything I was telling them, especially when I was dumped on the new and arrogant physician's assistant group of money-hungry young people. I was always afraid to stand up for myself. When alone with a doctor in the exam rooms where no exam took place, I finally got things done when I started causing trouble with documentation and took witnesses with me. Wish I would have done that at 35, and not have been so afraid to talk back to the bad doctors I had. Man, I relate to this. Turned 18 a few months back but have been dealing with pain literally my whole life. Never been believed up until recently. Even then, being believed isn't as much as I liked it to be. I'm on some meds, but they don't do much for me. And doctors won't put me on anything stronger because I'm too young. I hope your pain gets better eventually, too. Chronic pain fucking sucks. Frown. Hey there. I'm so sorry for what you're going through. I'm 31 but have been sick since my mid-20s. I've dealt with every last thing you've mentioned, as I'm sure many other people here have as well. We get you here. It is really hard when no one seems to believe you, but know that there's a ton of us out here who are willing to listen and be good company. I haven't worked since 2015. Definitely had tons of people assume I'm lazy and don't want to work. It's just shitty all around. Like, if I didn't have to lie in bed all day every day, do you think I would? FFS. I understand all too well. What gets me is had they taken me seriously, in my 30s and 40s, I wouldn't be in the shape I am today. Change doctors was always a common thing I heard, but that isn't as easy to do as people think it is, especially if any one of them have damaged you on your medical records. Had any of my doctors, which became young, fresh out of school physician's assistants, at an earlier age, actually did an exam on me, or sent me for imagings, they would have discovered my issues early on, and probably had me in better shape than I am today. In my 60s, they were always in and out of the exam room so fast, and on to the next exam room as fast as possible. Not one of them, in all those years, even did a simple range of motion exam or a pin test when I said I was numb. I was never examined or touched in any way, and I mean never. I always heard, well, you look good, and the times they've said walk back and forth for me for 2 feet and they said that was good always infuriated me, because of course for 2 to 3 feet in a small room, I can walk. The one thing I learned is always take a witness when you're seeing any provider for chronic pain, because Elva had some doctors and especially physician assistant make bold lies on their after visit summaries. They've repeatedly said they did examinations when I just sat in a chair the whole time. I've also been insulted and berated. The provider has all the power in the exam room, and when alone, they really can treat you like shit, ignore you and insult you, and even make fun of you to your face. Then, don't be afraid to report them right away, to their medical group and also to your insurance company, then up to the medical board, and it helps if you have a witness, as again, they will lie. Best of luck, and don't give people living with chronic illness what's something you wish others truly understood about your daily life.
Hi, it's voiceover me. So I know this bit isn't really like a Reddit story of people dealing with chronic pain and chronic illness, but I came across this a couple of days later and I thought everyone's answers in this Reddit thread was very, very interesting, and it very much relates to what I'm talking about here. There's so many great responses in this part on the Reddit thread. I go recommend you guys to go check it out yourselves. If I had every single one of these listed here, this would be like a 10-hour video, and I'm not doing that. Anyway, enjoy the rest of the video.
Chronic illness isn't visible. I may look fine but still struggle. It's not laziness. Acknowledgement helps. I'm young and look healthy, so people assume that I am, makes it really difficult for people to take my illnesses seriously. And depending on the illness, the lack of strength can make you seem almost cruel. I got relatively built before I was hit in my late teenage years, and since then struggle to carry basic things without serious repercussions. But if you're a young-looking guy and you have an older parent or any sort of woman carrying something that looks heavy instead of you doing it, my god, do you get daggers stared at you so that you feel even more shit. I'm not pretending to be sick. I'm pretending to be well. I get so tired after a certain amount of physical activity. I do not get to determine the amount, and I also do not know the amount until moments before. I'm not lazy. I wish every day of my life to return to 2021 to 2022, before my body gave up on me. To be able to hit the gym in the morning for an hour, work for 8 hours, cook a meal, and go to therapy all in one day, but I just can't. After a day my muscles are jello, and I feel so weak, and any amount of physical effort has me panting and my heart racing. I'm so tired. When you ask me how I am, I lie to protect your feelings. I don't want pity. Each day is different. Sometimes I need a cane. Sometimes I need braces. Some days I don't need aids. You're too young for that. Problem is not the encouragement you think it is. It's dismissive, interpreted as a disbelief of my experience. And for the love of God, don't mention wait till you're my age, because those are literally the thoughts that keep me up at night if I let them, because I already feel your age. Pain and suffering isn't a competition. And, more softly, it's okay to vent to me about your pain/struggles, too. It doesn't matter who has it worse. We all struggle and we all need support. Lastly, do not confront people who have placards or show them hate, even if they look young and healthy. So many disabilities are invisible, and someone already struggling can be one step away from a breakdown. Don't let your self-righteous gatekeeping spiral someone who is already probably battling their own that every single day is different, and very normal things for you can be completely draining for me. I don't have the same battery that you do and tend to run into energetic walls that come out of nowhere. It's more than just getting tired, it's a complete fault in my system. I process my surroundings differently than you do, and I'm constantly trying to find a balance between living in the world that's built for us and living in the body I was assigned to.
So those are some stories I found on Reddit. Again, I do recommend going onto those two subreddits, the chronic illness subreddit and the chronic pain subreddit, to go look at more stories of people going through this kind of stuff and what they deal with on a daily basis. I do recommend, if you are dealing with chronic illness or dealing with chronic pain and you kind of feel like you need some support, please go to those subreddits. I was going through a lot of the stories and reading a lot of the comments, and it does seem like those two places are a very healthy and good place to go to if you just want to find a community that are dealing with chronic pain and chronic illness. It's very, very sweet. I will put those two subreddits down below if you guys want to go there yourselves and find a little community, or have people understand what the hell you're all going through. So I'll put those in the description down below, so if you guys want to go there, go ahead. And again, those will be on my website on this week's episode as well, in the sources section. But basically that's what a lot of people with chronic pain and chronic illness deal with on a daily basis. Again, there's so many more stories out there that I couldn't cover just because of time and all that. Now I'm gonna move on to basically a little bit of my own personal experience. I mentioned it briefly earlier in the video, and also what I've witnessed from my friends dealing with chronic pain and chronic illness, and just hearing their stories of what they have to deal with on a daily basis. And it's absolutely shit, and it makes me so sad that I can't do a thing about it. Talk about this briefly earlier in the video. I talked a little bit with my own issues. Well, I will chat about that a lot more later on in the mental side of having a hidden disability, it's still fucking shit, that I might add. I've seen and witnessed and heard stories from my friends that have chronic illness and are dealing with chronic pain, and it absolutely breaks my heart hearing the shit they have to deal with on a daily basis of people and doctors not taking them seriously, or think it's nothing, or think they're just lazy, or they're just like pretending to have it so they can get out of work or something, when it's a very much a real thing. And I've seen people lie saying, oh, I can't do this because my wrists hurt, when they bluntly don't have a hidden disability. So there's also people like that, and that's kind of a shitty thing about it, is some people just lie to basically pretend they have a hidden illness, hidden disability. And weirdly, the people that lie about that kind of shit get way more respect than people that are actually dealing with chronic pain or chronic illness or any of that kind of stuff. And I think that's absolutely fucking bullshit. Like, what the hell? Make it make sense? You know those stories where people lie they have cancer and they don't, and there's so many more people that like praise them and give them money for it compared to people that actually have cancer and they get disregarded? Like, make it make sense. Why do the liars of society get respected way more than people that actually are dealing with those actual problems? And anyway, back off that tangent, and hearing the stories from my friends that are dealing with people aren't taking them seriously, or doctors aren't taking them seriously, or the doctors can't find anything wrong with them, and because it's not showing up on their normal everyday tests, because it's not ticking the right boxes from their medical reports, and it's absolutely tragic. And it breaks my heart just hearing those stories from my friends of what they're going through, and I can't do a thing about it, and all I could do is just listen to them about what they're going through, and it makes me feel so sad about it. Like, I wish I could do more. Like, every time I hear my friends talking about what they're going through, I wish I could help them. I wish I could, but I really can't. So all I can do is basically just listen to what they're going through and try to sympathize as much as possible. And also with like dealing with a hidden disability myself, stigma against it as well. And I still very much, it's absolutely heartbreaking, and just basically hiding what problems you're going through from society because people refuse to understand or get, and calling them names or basically making fun of them or call them lazy just because they can't get out of bed for a day because of 3 or 6 or a full-on week because of how much pain they're in, or they don't have the energy to do anything else other than say maybe attempt to clean their room or do the dishes or maybe make a healthy meal for themselves, or they can't even use their hands because of what pain they're going through. And even on top of that, people that are doctors that don't take them seriously and think they're basically seeking drugs and stuff like that, because again, like I said earlier, there are people that out there that lie about shit like having a hidden disability for brownie points and sympathy, and they basically take advantage of that, and then they get drugs or basically get sympathy from people. And I think that makes it even worse for people that have a hidden disability, where the liars get respected way more than the people that are actually dealing with the situation themselves. I made a post about something the other day, and a couple of people have mentioned in my post saying, yeah, people in 2025 are 100% forgetting what empathy is, and I'm noticing that a lot more as well. These days, a lot of people are lacking empathy, understanding and being a little bit more self-absorbed. I think that also caused a little bit of the loneliness epidemic. I should make a video about that. I've only seen one video about that. Salim Toba, love her channel. That's like the only channel I've seen talking about the loneliness epidemic with young people. I chatted about that briefly in a couple of videos ago, but yeah, I will make a video about that. It's a very interesting topic. I kind of want to leave you off with this. If you have someone in your family members, or you have a friend or acquaintance, or someone even if you just work with, and they are dealing with a hidden disability, and they are brave enough to tell you they have it because of the stigma of basically society putting on them, please try to understand and get coming from that. Even if you don't understand it or going through it yourselves, just try to sympathize with them and just listen. That's all I want to say here, is because I think that would make basically the world a much nicer place for people that are going through and dealing with hidden disabilities. Because sadly, society puts stigma against things, even if it's bluntly not true, and it's sad. And I think we need to understanding and sympathy towards people, even if we haven't been through stuff like that ourselves. And sadly, if people bluntly can't see it with their own eyes, it basically to them it just does not exist. Okay, even if you can't see it with your own eyes, it doesn't mean it does not exist. It very much does exist. It's very much a real thing. People that are dealing with and struggling with every day, and even with what they're given doesn't even work sometimes. And it literally doesn't matter what gender you are. It doesn't matter how old you are. What pain you're going through is real, and it should be respected and understood and taken seriously, no matter what age or gender you are. And this video isn't me saying, oh, this is what hidden disabilities are. This is more like trying to show people, please try to have more understanding and sympathize with people that are dealing with this, that are having hidden disabilities. That's what I kind of want this video to be, to basically just tell people to please have more sympathy and understanding for people that are dealing with this, because you know, it's not their fault. They were born this way, or something happened to them and now they are this way. It isn't their fault. Okay, so please try to be understanding of what the hell they're going through, because I think that would make it a lot more better for, I feel like, all of us in society. But we need to start changing for the better, I think. And all I want to say is, please have more understanding and empathy towards people, especially with shit you've never been through. They have been through it, and they just want someone to listen to them or understand what they're going through. So please try to show more empathy and understanding towards other people. That's kind of what I want to end off with. All my sources and everything I used in this video will be in this week's episode on the website. And again, if there's anything I missed or did not get right whatsoever, or you just want to share your own personal story with dealing with a invisible disability, please let me know. I'll pin it in the comments down below, or I'll bring it up in my next video. Or if you guys don't feel comfortable sharing your own story online and just want to send me an email about it, you can send me an email. My email is on the website as well, and I'll go read it and not share it with anyone if you guys feel comfortable doing that. If you don't, that's totally fine. Again, I totally understand. Hope you guys learned something. Hope you guys leave this video with a lot more sympathy. That's what I want. Please leave this video with more sympathy towards people. That's what I want. Thank you for watching this week's video. You can subscribe if you want to, it's okay if not. I upload every week, sometimes 3 times a month, depends what I'm working on. And if you guys want to keep up to date with the channel, you can follow the channel's social medias, that'll be on the description down below. And if you want to follow me personally, all my social medias are down below as well. And I think that's it for my little spill bit, I think. But yeah, thank you for watching this week's video. Bye!